Hey, Dr. Collins here from Envista Medical Neck and Back Center, and welcome to your new patient pre-report of findings class. Very important, so please watch this when you have time to pay attention. And if you have a co-decision maker, a spouse, a significant other, somebody that's going to want to be involved in the plan of care that we're going to recommend and is going to help you, support you through the process, and if there's an out-of-pocket expense, which we'll discuss with you in your report of findings, we'll go over what your insurance covers, what it doesn't cover, what out-of-pocket expenses you have. They're going to want to watch this class and also attend, if at all possible, the report of findings or your case presentation where we go over your x-rays, MRI results, the plan that we put together, and answer all your questions. So this is designed to empower you to make an informed decision on the recommendations that our team is going to make for you. And again, congratulate you for taking the time to do that. So our purpose is to help not only relieve your pain. We want to relieve as much of the pain as we possibly can. We also want to restore and protect your health. We want to help provide the most effective, safest, advanced treatment options that are available. And again, we want to empower and educate you and our community on what health is, how our bodies work, what are all the different natural, safe, effective treatment options that are out there so you can be actively involved in that care plan. So who are we? We're an integrated and regenerative medicine office. We believe in fixing the structural root cause of the problem, working with your body to help repair itself. We have multiple highly effective techniques, some of which we'll be discussing in this presentation. And we use a team of doctors, chiropractors, support staff to approach most of our care plans. We've had decades of experience. Each of our providers have all been practicing for 20 to 30 years or longer. We've helped thousands, if not tens of thousands of patients with all types of pain and health challenges. And we like to do this without using dangerous drugs, risky injections, and sometimes often unnecessary surgeries. And we are very trusted by our patients, who often tell us we're some of the best doctors, if not the best doctors ever seen. And most patients wish they would have met us years or decades ago, because we are committed to help you live a higher quality of life and committed to your success with the program that we present in the office. Just the fact that we're going to present a program to you means we can help you. We don't accept all patients. We only accept patients we truly believe that we're going to be able to help. So we believe the body can heal itself, that the key to all healing happens from innate God-given ability to heal. It's not the Band-Aid or the cast that heals us. It's the body that heals. So our goal is to increase your body's ability to heal and support that. So to understand healing and how our body functions, you have to understand the role of the nervous system. The nervous system consists of the brain, brainstem, spinal cord, and millions of nerves that go out to literally every organ, tissue, and cell in our body. We call it the master control system. We live our lives through it. Everything we see, hear, touch, smell, taste, think, all happens through our nerve system. And all of our body functions, our heartbeat, our muscles, our stomach acid, our blood pressure, our moods, our performance, our immune system, our pH system, all happen in a very vast and complex system called our nerve system. And our nerve system controls and orchestrates all healing as well. So healthy nerves, healthy body, better life. When your nerve system's function at its best, your power to heal is at its best. So what can interfere with that nerve system's ability to function? Well, the number one thing is subluxation. Subluxations are bones in the spine that get misaligned due to traumas, accidents, and stresses throughout life. We have 24 bones in our spine. You can see 5 colored green bones in the bottom. Those are your lumbar spines. 12 orange bones in the mid-back area, your thoracic spine, and 7 cervical or neck bones. When these become misaligned, they put pressure on nerves. When they irritate the nerves, they cause multiple things to go wrong in the body, both creating imbalances in the muscle, structural, spinal system, as well as the overall communication system. So these subluxations interfere with nerve system. This has a negative impact on our health. And for your body to truly heal, we must optimize that nerve system function. So subluxations interfere with the nerve system. The spine and the skull are designed to protect that nerve system. Misalignments due to traumas create interference to that nerve system. This interferes with our body's ability to function. And again, oftentimes this creates a negative impact without obvious warning signs. We don't always get pain when that happens. So when we correct subluxations, we enhance your function and your body's ability to heal naturally. So putting all that together, fact one, our living bodies are self-healing and self-regulatory. And fact two, the nervous system controls that body and its ability to heal. And three, when you put all that together, if you interfere with nervous system through subluxations, this causes a major negative effect on our health and well-being and leads to many of the degenerative conditions we see in today's world. The longer this goes untreated, the worse it becomes. And unfortunately, the harder it becomes to fix and the more challenging it becomes. So early detection is key. The best chance you have to live a healthy life is to correct these subluxations as early as life as possible. So getting your kids checked would be something to discuss as you progress through care. So two main problems that you will notice, and hopefully two big improvements you will notice as you progress through care. One, body imbalance. Subluxations cause muscles to tighten up, go weak, create an imbalance, pulling our shoulders uneven, our hips uneven, twisting our pelvis. And this creates uneven stress on all of the weight-bearing joints, and why knees and hips wear out, why shoulders wear out, why discs in the spine wear out. That creates an imbalance, just like driving your car out of alignment. So system imbalance, a little harder to measure and see if you look at yourself in the mirror, or we throw your x-rays up on the TV, which we will likely do on your report of findings visit. You can easily see the effects, the wearing down of discs and joints. It's harder to measure the nerve system, but we know it's there. 125 years of chiropractic care has more than adequately demonstrated and documented and scientifically validated that these subluxations leads to nerve affection. That affects every system in your body, not just the muscle system. It weakens and suppresses your body's ability to heal and repair, and this causes damage over time. And not always pain. Pain comes later, typically. So full alignment, better optimal function, better health for life. That's our ultimate goal. The only thing that can repeatedly and consistently reduce and eliminate these subluxations is the skillful chiropractic adjustment. So oftentimes with our plans that we're going to recommend, especially if it's a spine plan, we have a spinal issue, sciatica, neck pain, back pain, headaches, or even some of the joint plans that we do, or even some health plans we do, are going to all base around chiropractic care, because it is so important. The spine and the nervous system is the foundation of health. And even if you say you've tried chiropractic care, had limited results, oftentimes because of the skill and the intensity and all the supportive treatment we do with chiropractic, we can get results in a few visits where often other doctors have failed. So the goal, restore brain to body communication, restore normal function, enhance your healing. And this has the side benefits, unlike drugs that have side effects that are negative. Chiropractic side benefits are positive: less pain, better range of motion, more energy, improved sleep, better moods, and much more. So there are three parts of the nerve system: motor nerves, autonomic nerves, and sensory nerves. Sensory nerves are your check engine light, the smoke detector that goes off to let you know you got a fire. These are the ones that get your attention, right? Hey, we got a problem. Do we want to just pull the battery out of the smoke detector, take some Tylenol, Modevil, numb it, some gabapentin, right, some Lyrica, and then just ignore that we got a major problem going on? Maybe not the best approach. Motor nerves control function. That's muscles contracting. That creates the body imbalance that we talked about. And then autonomic nerves control all the vast, complex regulatory functions that go on through our organ system. So you can see about 90% from our pie graph here chart, 90% of the nerves are motor or autonomic, split about equally, and about 10% of the nerves give you pain. So again, pain is the last thing to come and the first thing to go. Chiropractic care isn't based upon getting rid of pain, although that's why most patients come to see us, and it's definitely going to be one of our primary goals, is to reduce or eliminate your pain. But we really want to optimize the autonomic nerve system, the motor nerve system, increase that body's ability to function, adapt, and relate to your environment. So this is an interesting study they did decades ago, just showing that if you can keep the body free of subluxations, you can really increase brain efficiency by 70-80%. And that just means your body can heal better, like upgrading your cell phone or your computer, getting rid of a virus. All of a sudden your life gets a lot easier when that computer is working on the the 5G or the full fiber network, right, with no interference to it. So that's what our goal is. So chiropractic boosts immune system, dozens and dozens and dozens of studies showing this. Here's two. study showing a 200% stronger immune system. People have been under regular chiropractic care. And then one done on HIV patients showed a 48%, which is a huge increase in their CD4 cells. So stronger immunity, better resistance to getting sick, less sick days, more energy, better sleep recovery, improved well-being, less chances of getting cancer and all these autoimmune conditions, all that kind of stuff with chiropractic care. So oftentimes we're going to recommend what we call DME, or durable medical equipment, with your care. The three most common ones for spine programs are going to be a Denon roll to get the curve back in your neck here. You're just going to lay on that at home and help reshape the proper curve in your neck. We can do an LSO, or back brace, that's going to support and heal your lower back. And then a TENS unit, which is our electronic Advil to help reduce muscle spasms, pain, increase circulation, and keep you off the dangerous medications while we work to get your body healing. So trigger point injections are another advantage. Since we do have medical providers, we can do trigger point injections. We don't like putting steroids in the body whenever avoidable because of the side effects. Lidocaine has very minimal side effects and works very well with some dry needling and lidocaine into the tight trigger points in the neck, mid back, lower back area, wherever we find or you have the major troubles. Really goes a long ways to breaking up spasms and restoring normal body function. So trigger points are not designed to get rid of pain. They're designed to break up really spasmed and tight muscles so that your adjustments and PT and rehab could restore well. So we usually just do 3 to 4 in each area of complaint: neck, mid back, lower back. That's usually enough. A lot of insurances will help cover some or all this expense. If it wasn't added to your plan and you'd like to do it, you can always talk to our staff about adding those in. We're happy to answer any questions you have. So there are 3 stages of care that we're going to be talking about. We're going to focus on the first stage of care, phase 1, intensive relief care. Our goal is to get you feeling better as quickly as possibly. That generally means 2-3 times a week into the office, 30, 45 minutes, maybe an hour per session when we add in all the different things. Very, very important to build momentum fast. Most of our patients are doing better 4, 5, 6, 7 visits in. Sometimes one visit can literally be life-changing, but the goal is by the time we get through that initial phase of care, whether that's 6, 12 visits, whatever it is, that we're feeling better, 25% better, 50% better, 75% better, maybe 100% better, more range of motion, less inflammation, right? And then we're going to move into phase 2, corrective care. We could be pain-free here in some cases, but we still want to stabilize. This is like, making sure we don't lose the momentum that we have. This can be another 6, 8, 12 visits. We can slow the treatment schedule down from 2 to 3 times a week to 1 to 2 times a week, maybe even in some cases to every other week. And then phase 3, 20, 25, 30 visits on a typical case. We're going to get people 80, 90%, maybe 100% as good as we can reasonably expect to get them. And then our goal is to do what? We just want to maintain you there. Our goal is to simply keep as much of that correction for as long as possible. That's generally 1 to 2 visits a month. Every other week is a good plan for most people, although some people might come in once a week or every third week or once a month. And in rare cases, maybe every 6 weeks to maintain that. But typically every other week's a good maintenance plan. We take it one step at a time, phase 1, and then we reevaluate, re-talk to you. So most likely the plan we're going to recommend is just going to focus on that first phase when you come in for your report of findings. So relief today, correction tomorrow, and then let's maintain this for a lifetime of health and well-being. So when we look at your spine from the side, so from the front, we would want to see the shoulders level, the hips level, the head level, right? From the side, we actually want to see some curves or an S-shaped curve. You'd have a lordotic 30-degree or so cervical curve, a 20-degree kyphotic thoracic curve, and a 30-degree or so lumbar curve. This is our spring or shock absorber that allows us to withstand the stresses of gravity, jumping, running, all that kind of stuff. When you lose the curves, it increases 5-fold, 10-fold the stress on the disc, and over time, those discs break down, then they wear down, then they bulge, and then they potentially herniate, and then that can lead to invasive, costly surgeries that oftentimes don't get you the results you want, sometimes leave you worse, and sometimes even can be quite dangerous and even fatal in some cases. So the goal would be to catch it early and restore as much balance, function, and curvature to the spine as we can. Again, from the front, we want to see a nice and level. From the side, we want to see that S-shaped curve. So alignment is the foundation to good health. Again, just like driving your car to alignment, you're going to wear that tire out. right? It's going to pull to the side. It's going to create uneven stress and strain. So we want to reduce pain, improve function, enhance wellness, and we want to keep your body in alignment, just like hopefully your mechanics and your tire shops are keeping your cars in alignment. Once you lose your discs, they're near impossible to get back. So we really want to maintain those discs to the best of our ability. So there are different stages of degeneration, that we'll go over. The earlier we get you, the better. But even if we get you here in the wheelchair stage, it's not uncommon to get you back walking again. So we want to catch you early as we can on this cycle, get the kids checked early. But no matter where you're at, we're going to restore alignment and try to get a better life for you. So wellness is a lifestyle choice. The sick care business, what the medical doctors typically do is wait until you're in bad shape and then give you some pain pills, give you a pain shot, burn some nerves, maybe do surgery. Those are dangerous, they're expensive, they have risks, and they never, ever actually fix the root cause. Wellness is a proactive thing. Like, what can I do to proactively restore my health? So we really love patients that are looking for the wellness lifestyle. It's really what we love to do is not be reactive, but be proactive. So congratulations for taking the time and looking to not only deal with this crisis that probably left you in the hospital, but hopefully build a wellness plan. We would love nothing more than to take care of you and your family for years and years and decades to come, and put a plan together where 5 years from now you're healthier than you are now. You're doing things, to a better degree than you can now. That's really our main goal. We get one body, we get one life, and we believe you're worth investing in. Let's invest in our health today. We want to make better choices. We want to take action now. We want to create a healthier tomorrow together. That's our goal. So we have more value and more confidence. I like to save money. Most people like to save money. So we do have some ways to save money I want to prep you on before your report of findings. We do have what I call my non-procrastinator same-day discount. So we're going to give you a discount for making a decision at that report of findings. That saves us time and follow-up, and it locks you in for care. So we find patients that can make quick decisions and prepay, pre-book out their appointments. They tend to do the best, and they're the best patients to work with for sure on our end. So we do have a same-day commitment. No high pressure, just, you can save some extra money if you're prepared to go ahead and make that decision when you come in. So again, if you have a co-decision maker, bring them with you, log them in on Zoom, put them on a three-way, or at least prep them that you're going to be going through this process and we're going to be spending some money, bring the credit card in with you. We do a prepaid discount, usually a pretty substantial discount, usually 10, 15, up to 20% off if you can just pay for that, swipe it on a credit, write a check, get the airline miles. That again saves us time in billing, locks you in for care. A lot of our patients like to take care of that. We do offer a couple guarantees. One, we do a best price guarantee. We'll guarantee our pricing will be any competitors that we have. You'll not find somebody that will have a comprehensive plan, apples to apples across the line for a better price than we do. We're 25, sometimes 50% less than our competition on our pricing. So we will guarantee that best price, or we'll refund the difference plus 10%. Or maybe even as 20%, I forget, that'll be in writing for you, but we do guarantee the best price. So you don't have to worry about that. And then we're going to guarantee your satisfaction the best we can. We can't help everybody, but we really do try to only accept patients that we think are in alignment with our goals and that we believe we can help and that want to get help and participate in care with us. So part of our screening process is you're screening us to see if we're the right office for you. We're also screening you to see if you're the right patient for our office. We do occasionally turn away patients that we do think we can help with what we do, but they just don't have the right attitude. They're not a right mix for us. They're not a right fit for our culture and what we want to do, and we don't want an upset with that patient. So if you're not happy, we'll do whatever we can do reasonably to try to make you happy, right, as well. So we can talk more about that in the office, but why choose us? We are different than any other office you're likely to find in the Central Valley, maybe the state of California, maybe the whole Western Coast. We're a non-surgical solution, right? We go after the cause, not the symptoms. We use a lot of advanced technology, decompression, stem cells, PRP, peptides. We have a team approach, so we have a collaboration of multiple highly experienced, motivated, passionate, caring doctors and support team that are going to work together with you. We have high success rates. We have helped thousands or tens of thousands of patients avoid pain, avoid surgery, get their lives back. We have at this time 700 4.8 star reviews. We expect that to be over 1,000 with the amount of patients that we help here by the end of the year. And we're going to personalize your care plan to you, okay? We're going to sit down, listen to you, make sure we got the right plan to you. We're going to provide you hope, restore function, improve your life through gentle, effective, safe, and lasting solutions. That's our mission. So your best health is still ahead of you. When we work together with the right plan, the body has an incredible ability to heal and resolve. So our investment, our commitment to you is we'll listen, we'll take the time, we'll create a personalized plan, we'll guide you through it, we'll do our best to educate you. Some of that will be in things we send you electronically to watch at home or listen to at home, and we'll always do our best. Each day we'll do our best. Every day is a little different. And, but each day we're going to try to do our best to help you. So we'll only recommend care that we believe is in your best interest. We'll not pressure you. And we are going to offer some incentives to get you to take action because our patients need that. They need us to be their coach and cheerleader. We'll explain everything the best that we can and have an informed decision. We'll treat you like our own family. We try to only accept people we can help and make recommendations like we would if you were our mother, father, sister, brother, uncle. So the next step is up to you. Let's build your personalized plan. Go over it. We're here for you. Let's do this together as well. So today is a new beginning. I'm looking forward to hopefully meeting you myself in the office, but my team is ready and willing and highly trained and passionate to help you, and they will be there at your next visit. Thank you so much.